Hi, my name is Karen. My topic is fetal alcohol syndrome disorder. Agenda. We're going to be looking at what is fetal alcohol syndrome disorder, diagnosis criteria, course and prevalence, prognosis, cultural consideration, the history of the disorder, assessment and differential diagnosis, treatment, and lastly the vignette. What is fetal alcohol syndrome disorder? The term fetal alcohol spectrum disorder refers to a wide range of physical and behavior and cognitive impairments that occur due to alcohol exposure before birth, also known as prenatal alcohol exposure. These impairments may appear anytime during childhood and last a lifetime. Diagnosis criteria: doctors will look at prenatal alcohol exposure, central nervous system problems such as small head, problem with attention and hyperactivity, poor coordination, lower than average height, weight, or even both, abnormal facial features such as small head, small eye opening, small nose, thin upper lip, underdeveloped jaw, low nasal bridge, flat midface, and it would also include vision and hearing problems. Diagnosing with FASD can be difficult because there is no medical test for this condition or for the other types of FASD. Now, when I was looking for fetal alcohol syndrome disorder in the DSM-5-TR, there isn't one. However, there is one of the types of FASD in the DSM-5-TR, and it is the neural behavior disorder associated with prenatal alcohol exposure. According to the DSM-5-TR, it was mentioned briefly that a clinical diagnosis of fetal alcohol syndrome, including specific prenatal alcohol facial dysmorphia and growth retardation. Course and prevalence studies conducted by the Center of Disease Control and Prevention have revealed that 0.2 to 1.5 cases of fetal alcohol syndrome occur per every 1,000 births in certain areas in the United States. It is said that scientists believe that 2 to 5% of the U.S. population may have FASD due to children being misdiagnosed with ADHD. It's been reported that the prevalence of FAS in disadvantaged populations such as Native Americans, Blacks, and other minorities can reach to 3 to 5 cases per 1,000 children. Research also suggests that poverty is strongly associated with women's alcohol use before and after pregnancy, which results in excessive amounts of children with FASD in advantaged populations. Prognosis. When it comes to the prediction about the course of disorder, FADS are preventative. If the baby is not exposed to alcohol before birth. Therefore, if the mother abstains from alcohol during pregnancy, FADS can be avoided. It is prevented by educating soon-to-be mothers of the well-being of their baby and how alcohol can have a negative effect on their baby due to them drinking. Importantly, soon-to-be mothers have to know that there is no safe amount of alcohol during pregnancy or when they're trying to get pregnant. Some women have this misinformation that they're not aware that drinking wine or beer can cause the same problem as drinking hard liquor. They have this idea that drinking beer would cause no harm, or that if drinking once in a while is not a big thing, and however, they are wrong. Soon-to-be mothers may be suffering from alcoholism or using negative coping habits such as drinking to block their pain, their struggles. Therefore, these women need help with their alcoholism, so they do not turn to alcohol to numb their pain and instead use good coping skills. Culture considerations. Around 10% of women consume alcohol during pregnancy, of whom 1 in 13 would deliver a child with FADS, and 1 in 67 a child with FAS. Previous studies report Black, Asian, and Hispanic women drink less than white women during pregnancy, while non-Hispanic Black women are up to 48 and 62% less likely to drink alcohol during pregnancy and binge drink compared to non-Hispanic white women. There is a connection between poverty, ethnicity, and fetal alcohol spectrum disorder is well established. It is estimated that 12% of American women continue to drink after they know they are pregnant, and meaning that 1 in 8 children are exposed to alcohol. The history of the disorder. Dr. Jones is considered to be the father of fetal alcohol syndrome. Dr. James, along with his colleague Dr. Davis Smith at the University of Washington, were the first to identify FSD and to name the disorder in the United States in 1973. Dr. Jones' research has focused on the evaluation and diagnosis of birth defects, identifying the mechanism of normal and abnormal development, and as well as new agents that cause birth defects. In 1973, Jones and Smith examined a group of 8 children at the University of Hyperview Medical Center to determine what caused these children's developmental delays, and they observed these children had some similarities with one another, such as growth deficiency, abnormally small heads, and delays in cognitive development. They soon realized they all had one thing in common, and it was that their mothers were all alcoholics. And another thing to note is that when they came up with the name fetal alcohol syndrome disorder, Dr. Jones named the disorder by this disorder caused in children during their fetal stage, and also because of the use of alcohol was the cause of the disorder. So that's how they came up with the name. Assessments include a 4-digit code. The 4-digit code of ADSD looks at 4 features such as growth deficiency, facial dysmorphia, structure and or functional abnormalities, prenatal alcohol exposure, and it's all based on ranking each features independently on a 4-point scale. 1 meaning a complete absence of the FASD, and a 4 reflecting a strong presence of FDSD features. Another assessment includes a neural behavior screening, which looks at cognitive communication skills, memory and executive functioning and abstract reasoning, attention/hyperactivity, academic achievements, and as well as social skills. Differential diagnosis. So it looks at 3 distinct features such as growth deficiency, facial abnormalities, central nervous system dysfunctions, which do not occur in other disorders. So doctors will look at prenatal alcohol exposure, although confirmation is not required to make a diagnosis, central nervous system problems such as small head size, problem with attention hyperactivity, poor coordination, lower than average height, weight, or even both, and abnormal facial features such as, the small ridge between the nose, thin upper lip, underdeveloped jaw, small head. And treatments include, there's no cure for FASD, but research show that early intervention treatments can improve a child's development. There are many types of treatment options, including medication to help with some symptoms and minimize the behavior, such as behavior and education therapy, parenting, training, and other alternative approaches. No one treatment is right for every child. Therefore, every child has different problems. They're all not alike to each other. And good treatment plans would include close monitoring, follow-up, and changes as needed. Treatment is adjusted according to each child's needs. There's no medication to treat fetal alcohol syndrome specifically, but there are certain medications that can help minimize their behavior, such as, taking antidepressants, anti-anxiety stimulants, and neuroleptics. Another thing to emphasize that the medication used to treat it's used to treat symptoms like specifically like attention and behavior issues. And when it comes to parenting treatment, it can help parents to help cope with their child's behavior, education, and social challenges. So parents might learn certain skills to help their own child with the disorder. And it's also best for them to learn to help their own child. Okay, Sam has come to the doctor for the following symptoms: has a small head, lower body weight, has a low IQ, difficulty with attention. Mother has a history of alcohol abuse. Speech and language is delayed, thin lips, and difficulty in school. In the picture shows just a point, and something to note is that there are 4 diagnoses under the FASD. And here are my references, and thank you.